In the heart of the hospital, where science meets humanity, radiology stands as the unseen guardian, detecting, diagnosing, and directing the path to healing. But beyond the scans, beyond the technology, there's something greater. A legacy. A legacy built by visionaries who saw the unseen, by innovators who redefined the possible, and by healers who dared to believe in something bigger than themselves. This is their story, and it's our responsibility to carry it forward.
So I'm Stephen Seltzer, was born in Philadelphia and went to medical school at the University of Pennsylvania. Moved to Boston in 1976 to do my residency at what was then the Peter Brigham Hospital, which dates me immediately of how far back it goes. And stayed for 4 years of residency and never left. So spent my entire career here. When I was a younger faculty member, I was interested in abdominal imaging, and at about that time in the early 80s, the big technology in radiology was CT scanning. And that captured my interest, and I was the CT scan director for a number of years as we were modernizing our fleet and moving into some new quarters, which were really terrific. I've been fortunate enough to be the president of several national organizations over the years, the Association of University Radiologists, which has been around for about 70 years and is a national organization where the members are faculty and trainees in academic departments like ours. And I was on their board for a while and was president for a number of years, and was lucky enough to receive a gold medal from them for my service. Became the abdominal imaging section chief, and then in 1997, my predecessor as department chair, Len Holman, sadly became ill and had to go on a medical leave of absence. And Len and the dean asked if I'd be the interim chair while they tried to sort things out. And a few months later, unfortunately, it was clear he wasn't going to be able to come back to work. So I've been the department chair since 1997, did that for about 20 years, and then started trying on different retirement things. First few years with Dr. Boland's help and support, I was helping him with faculty and professional development. Since I knew all the people there, having been a Brigham lifer myself, and knew all the complexities and idiosyncrasies of the medical school about how people get their academic promotions and things of that sort, so I could help free him up to do all the other a million things that were going on in the department at the time. So it's been quite a wonderful experience to be part of the organization for almost half a century, and seeing how much it's changed, grown, accomplished over that period of time. And now I get to be a student of the next generation of all the changes that we're going through. Radiology has benefited over now really half a century from the explosion in technology, computer technology, advanced electronics, manufacturing technologies, computer networks, now artificial intelligence. Just, almost every decade there's one new thing after another. And the profession has really embraced them. We continue to take advantage of better ways to practice and better ways to take care of patients and better ways to do procedures that are minimally invasive. There's a concept that I had worked on, which I don't know will happen in my professional lifetime, but it goes by the name of the diagnostic cockpit of the future. And it's envisioning a day when all diagnostic radiology images as they are now are digital and can be moved anywhere, anytime. To be able to harness all of that brain power in one place at one time, I think would be an amazing future breakthrough, and something that could happen within the next decade, and would really be almost the zenith of bringing all of these new technologies together so they can support one another and not just be in silos. Every human being, and particularly every academic, feels as though providing a legacy is something that they strive for in their life. And if one is exceptionally fortunate, like me, to have been in the right place at the right time, surrounded by the right people, and given the opportunities to look ahead a little bit, it's extraordinarily gratifying, because we're only in these roles for a chance to run a lap or two, and then we have to pass the baton on to the next generation. And to be able to be seen as someone that inherited something terrific, added to it, and hands over something even better that facilitates progress is very, very professionally and personally gratifying. So the older I get, the more I think about legacy and how important that is to me. And I feel really blessed to have been around at this time.